Sebelius said is totally unsustainable. Democrat Senate Budget Committee Chairman Kent Conrad called it a Ponzi scheme in the first order. The President's policies have failed. It's time to enact the House Republican Plan for America's Job Creators. It's time to repeal the Class Act.
Expired. Gentleman from New Jersey.
Thank you.
Madam Speaker, I yield 2 minutes to the gentleman from New Jersey, Mr. Pascrell.
Gentleman from New Jersey is recognized for 2 minutes.
Thank you, Madam Speaker. You know, I'm tired of hearing the President is a failure. I'm tired, and you can smirk all you want. There's no perfection on this floor. There's no perfection down the street. And you didn't give these speeches in 2008 when we were losing 500, 600, 700,000 jobs a month. Not one of you came to the floor. Shame on you. And now, what we want to do, we want to turn our backs on those 10 million Americans currently who need long-term care. We have no alternative. We all agree that there needs to be change in the present system that has yet to work. We have to find a way to make long-term care both accessible and affordable. These problems will not simply disappear. They're not going to go away. This bill certainly does not fix these problems. The bill does not even provide an alternative. All it does is attack the progress made in the Affordable Care Act. You've tried to wean it down. You've tried to bevel it. You tried to covet. You tried to take all the money away that's going in order to have a system in this country that changed, that was not sustainable in the first place. 62% of small businesses over the last 5 years went under because they couldn't pay their health care bills. And you stand there with no alternative whatsoever. Whatever happened to the replace part of the repeal and replace? Remember that? Repeal and replace? That nonsense we heard last year? Without the Class Act, or an alternative. People who struggle the most with daily tasks due to illness will be the ones to suffer. You know that. You know that there are millions of people out there suffering, yet we have not come up with an alternative plan. Yet you condemn this. Yet you accuse everybody of failing, but you don't have a plan yourself. Where is your heart for the middle class?
Gentleman's time has expired. The gentleman, members should remember that all remarks should be addressed to the chair and not to one another. Gentleman from Pennsylvania?
I continue reserve.
Gentleman reserves. Gentleman from New Jersey. Gentleman from New Jersey has 2 minutes remaining.
And the Republican
and the gentleman from Pennsylvania has 4 minutes remaining.
You want to?
I just have one more speaker.
I think I suggested you go next because I only have myself, and then we're going to move to Ways and Means.
Madam Speaker, I believe we have the right to close, and we have just
correct, right?
That
is correct.
I'll reserve.
Gentleman reserves. Gentleman from New Jersey.
I just want to stress, I'll yield myself the balance of the time.
Gentleman's recognized.
Madam Speaker, I just want to stress again, you know, I hear from the other side of the aisle over the years how people should take personal responsibility. The idea of the Class Act is that people pay into the trust fund, and then when they become disabled, they take the money out to pay for services so that they can stay in their home, don't have to go to a nursing home. Now, when they do that, they save the government money because this is their own money that's being spent to keep them in their home, to keep them in the community, so that they don't have to spend down and then eventually become a ward of the state, essentially, because the fact that Medicaid ends up paying for their nursing home care. So this is a solution to a long-term care problem, not a complete solution, but certainly a partial solution. And I agree with Mr. Pascrell, which is that when I listened to the other side of the aisle, the gentleman from Texas was quite clear. Let's repeal the entire Affordable Care Act. If we can't repeal the whole thing, then we'll repeal it piecemeal, piece by piece, which is what's going on here today. Well, again, it's not a very responsible position unless you come up with an alternative. We're in the Energy and Commerce Committee. We've had hearings on this. I've yet to hear anyone come up on the Republican side with an alternative. All they keep saying is, let's just repeal this and we'll figure something else down the line. The problem with that is that Mr. Pascrell said there are 10 million Americans who need long-term care. Soon it'll be 15 or eventually 20. So every day that goes by, there is not a solution for these people. And the disabled community and the senior citizen community are crying out for some kind of relief. So all I say to my colleagues on the other side of the aisle, don't just keep talking about repeal. I'll use the term mend it, don't end it. Let's not end today the effort to try to find long-term care solutions for America's seniors and for the disabled. It simply isn't fair to come here on the floor repeatedly and say, repeal, 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 and not have an answer. And I'm more than welcome with the chairman of the subcommittee or any other member to sit down with any of you at any time and come up with a bipartisan solution. But I haven't heard it yet. Thank you, Madam Speaker.
The gentleman's time has expired. The gentleman from Pennsylvania.
Thank you, Madam Speaker. To close, on our side, I yield to distinguished member of the Health Subcommittee, Dr. Gingrey, for such time as he may consent.
The gentleman from Georgia is recognized for 4 minutes.
Madam Chairman, as co-lead sponsor of this bill, I rise in strong support of H.R. 1173. I commend Dr. Boustany. I commend Chairman Pitts for their leadership on this issue, and I thank Mr. Lipinski on the Democratic side. In response to a question I put to him in March of last year, CBO Director Douglas Elmendorf wrote, and I quote, "The Secretary of Health and Human Services has now concluded that the class program cannot be operated without mandatory participation so as to ensure its solvency. HHS Secretary Kathleen Sebelius called the program insolvent, and Democratic Senator Kent Conrad, chairman of the Senate Budget Committee, called the program in 2009 a Ponzi scheme. In fact, he went on to say that it would make Bernie Madoff proud. Madam Chairman, during its consideration in 2009, the CMS actuary, Richard Foster, told the Obama administration staff that, and this is his quote, 36 years of actuarial experience lead me to believe that this program would collapse in short order and require significant federal subsidies to continue, end quote. He was ignored. In fact, he was eventually cut out of the email loop so that they didn't want to. The Health Committee on the Senate side and the staff of Senator Kennedy, they didn't want to hear any more from him. Subsequently, in December of 2010, the President's Fiscal Commission recommended that Congress reform or repeal, not amend, reform or repeal the Class Act. The Commission report stated that, quote, absent reform, the class program is likely to require large, massive general revenue transfers or else collapse under its own weight. The Commission advises the Class Act be reformed in a way that makes it credibly sustainable over the long term. To the extent that this is not possible, we advise that it be repealed, end quote. In February of 2011, Secretary Sebelius testified before a Senate Finance Committee hearing that the class program was, quote, totally insolvent, unquote, as structured, and it needed to be reformed in order to work. Then, in October of 2011, the Secretary released a report on the Class Act that essentially found the Obama administration could not make the program actuarially sound or credibly sustainable, to quote the President's Fiscal Commission, over a 75-year period. Thank God for Senator Judd Gregg, Madam Chairman, in putting that amendment on the Senate side that called for fiscal sustainability certification by the Secretary over a 75-year period of time, or it could not go forward. And that's exactly what happened. Madam Chairman, based on the evidence, the class program is not simply flawed, it is broken. And as currently written, it poses a clear danger to the fiscal health of our budget and to the American taxpayer. Madam Chairman, some of my colleagues in defending this broken program have told me that there's no need to repeal class because the Secretary has already abandoned it. Yet every day that we delay in repealing class, we prevent Congress from passing meaningful, true long-term care reform. All sides admit that class does not work, so the prudent step is to repeal it. Madam Chairman, in closing, I urge all my colleagues support this legislation so that we can get to meaningful reform of long-term care and have the marketplace work its magic in regard to this so the penetration is greater than the current penetration, which is less than 10%. With that, Madam Chairman, I yield back and urge all my colleagues to support the repeal of a broken, failed program, the Class Act.
Gentleman's time has expired. Will the gentleman from Louisiana rise?
Madam Speaker, I rise to claim the time allotted to the Ways and Means Committee in this debate.
The gentleman is recognized for 10 minutes.
Thank you, Madam Speaker. I yield such time as I might consume.
Gentleman is recognized.
Madam Speaker, as a physician, I know of this really dire need to solve the problem for many families across this country who are struggling with their long-term care needs. And as the oldest of 10 children, my father's a physician. He died 3 years ago from a lengthy illness and required a lot of care at home. He did not have long-term care, and we gladly bore that burden, and we were able to provide for him, even though it was somewhat of a strain. This is a serious problem facing every single family in this country. And yet, what we've seen now is a program that was created in Obamacare, a program that is clearly unsustainable by the administration's own admission. After almost a year now of wrangling about this, they finally come to the conclusion that we knew before the bill even passed that this was unsustainable. It was unworkable. It was fatally flawed. I know as a physician the worst thing you can do for someone is create false hope. And that's what this has done. And as long as this stays on the books, on the statute books, we're not going to get anything done on this. We're not going to solve it. And there are many good ideas on both sides of the aisle. We've discussed some of them in the Ways and Means Committee, and there are bills on both sides of the aisle that I believe we could work together in a true bipartisan fashion and solve this problem. But the class program is clearly not the answer. Washington should learn 3 lessons from this debacle. Obamacare's failed government-run program. First, don't ignore reality. Democrats ignored the expert actuarial warnings when they used class as a budget gimmick in Obamacare. President Obama cannot create a self-funded, sustainable program that prohibits underwriting unless he intends to force healthy Americans to participate. What does that mean? Madam Chair, that means an individual mandate. Another individual mandate. Many constitutional scholars think that this is unconstitutional. We don't need another individual mandate. In fact, Senator Harkin said the problem with class is that it's voluntary. I think he basically put the cards on the table and showed what they want to do to fix class is to give us another individual mandate. Most enrollees in class will be high risk, causing premiums to skyrocket under the current program, making class even less appealing to average American families. The premiums will be unsustainable. It will require subsidies from the taxpayer. So, first lesson, don't ignore reality. Second lesson, don't break the law. The administration planned to break the law by excluding Americans made eligible by the statute. And when Congressional Research Services attorneys warned of lawsuits, I sent letters to Secretary Sebelius for her legal authority to make this change. She then subsequently suspended the program, but this doesn't correct the bad law. And unless we repeal class, the Department of Health and Human Services will break the law when it misses deadlines in October and again in 2014. That's not a very good example to set for the American people to have the administration breaking the law. This letter I have, I ask unanimous consent to submit the letter for the record.
What'd you say? This request is covered by general leave.
Thank you, Madam Speaker. So, first, don't ignore reality. Second, don't break the law. Third, don't compound our nation's long-term fiscal problems. A Democrat Former Congressional Budget Office Director Alice Rivlin, under the Clinton administration, wrote, I quote, "Since the class program is a new, unfunded entitlement, it should be repealed because it will increase the deficit over the long term," end quote. In fact, the President's own Deficit Commission agrees our grandchildren simply cannot afford a new budget-busting entitlement. We can do better than this, Madam Chair, and we can work together to solve this problem. And I urge my colleagues on both sides of the aisle to support this class repeal, support H.R. 1173, and beyond this, we'll have the impetus to actually do some real work to create a real program that works for the American people. We can make it easier for disabled Americans to save for future needs, expand access to affordable private long-term care coverage, and better educate Americans on the need for retirement planning. I reserve the balance of my time.
Gentleman reserves the balance of his time. Gentleman from California.
Thank you, Madam Chair. I'd like to point out that the last time I watched television, they told me that we still have troops in Afghanistan who should be brought home, and we've not addressed the Medicare physician payment cuts, the payroll tax cut extension, unemployment insurance extension. Roads, bridges, and public transit systems are falling apart, and Congress hasn't brought forth legislation to invest in the infrastructure, to repair those vital structures. And we continue to have an imbalanced tax code that lets members of Congress get richer at the expense of working families. And we've done nothing to change that. Yet rather than tackle any serious problems, the Republicans are using the very little time that they permit Congress to be in session to debate repealing a law that the President has already made clear will not be implemented. In other words, we should repeal a law that isn't going to happen. Now, that's a vital use of our time. He's clearly stated, the President has, that the Class Act, as part of the Affordable Care Act, can't meet the tests put in statute. Now, remember that the Republicans probably would like to repeal all of Obamacare. And I'm not sure exactly which part they want mostly to repeal. In other words, I assume that the 2.5 million youngsters who now get health insurance, the Republicans would like to kick them off the rolls and let them go to work or earn their own way to health insurance. And it's lowered prescription drug costs, Obamacare has, for millions of seniors, for a bill that the Republicans wrote that was too costly. I presume the Republicans would like to raise the cost of pharmaceuticals for seniors. Republicans generally like to do anything that the pharmaceutical lobbyists ask them to do, and I'm surprised they haven't brought that up yet. I understand that my good friend Dr. Bastani actually has the makings of a bill that would help long-term care. And I also understand that the only reason he hasn't introduced it, I'd be glad to make it an amendment if it's ready to go right now, is that the health insurance industry doesn't like it. Well, if the health insurance industry doesn't like it, it must be spectacular. And I hope we'll see it. Maybe you'll tell us a little bit about it, and I'd like to applaud it because he's done some great work in this area. And we need to do this. The fully implemented Obamacare, health care, whatever you want to call it, by 2014 will extend affordable, quality medical care to 32 million uninsured Americans. That's a plan. Maybe we could change it. Maybe we can make it quicker. Maybe we can extend more people. Maybe we can save some money. But that has to come from the other side of the aisle. We've proposed this, and I'd like to think that our Republican friends would work with us to improve it and move us in that direction. How much time do I have remaining?
The gentleman from California has 7.5 minutes remaining. Would you like 7 1/2? Would the gentleman like to reserve, or?
Could I yield 2 minutes to the gentleman from Wisconsin?
Is there objection? Gentleman from Wisconsin is recognized for 2.5 minutes.
2 minutes.
2 minutes.
Thank you, Madam Chair, and I thank the gentleman, my friend from California, for yielding me this time. Madam Chair, I rise in support of the resolution. I do so because I believed at the time when the Class Act was inserted in the Affordable Care Act, it wasn't a sustainable program. And sure enough, when Secretary Sebelius and those at the Department of Health and Human Services had a chance to analyze it and try to implement it, they reached the same conclusion. I just hope that today my Republican colleagues don't take too much glee or delight over the fact that this resolution will pass and it is the repeal of yet another small section of the Affordable Care Act. Because just by repealing without replacing it doesn't solve the problem with the rising long-term health care costs that our nation faces. And I know my friend Dr. Bustani shares his interest in trying to find a fix to this situation. And I hope that the parties are able to come together and address one of the paramount challenges that we're still facing in the health care. How do you incent young, healthy people to invest in their long-term health care issues? Difficult to do. And I appreciate the work that went into those who supported class, recognizing the challenge that we face, trying to come up with a solution. This just wasn't the answer. And to my Democratic colleagues, I never believed with passage of the Affordable Care Act, which I did support, was the end-all, be-all of health care reform. In fact, the great potential of the Affordable Care Act was the vast experimentation that needs to take place in reforming the health care delivery system and the payment system to learn what's working and what isn't working, and then drive the system to greater efficiency, better quality outcomes, and a better bang for our buck. That, to me, is what health care reform is going to look like in the years to come. It's going to be an ongoing effort trying to determine what is working and what isn't. The Class Act, clearly, the way it was structured, was something that wasn't going to work. So I agree with the resolution today that we should repeal it. It's the same conclusion that the administration, having a chance to look at it, reached themselves. But it doesn't leave us off the hook of trying to find a solution to one of the great challenges of long-term health care in this country. So I would encourage my Republican colleagues, and I know many of them share this sentiment, that this does not end the work that has to go in. We've got to figure out a way to start talking to each other, listening, trust each other to come up with some solutions. This isn't that solution today. I yield back.
The gentleman's time has expired. The gentleman from Louisiana.
Thank you, Madam Chair. I'm pleased to yield 2 minutes to the distinguished gentleman from California, the chairman of the Health Subcommittee on the House Ways and Means Committee.
Gentleman from California is recognized for 2 minutes.
Thank you. Madam Chairman, I rise in strong support of H.R. 1173, the Fiscal Responsibility and Retirement Security Act. It's now clear that long before the Democrats' health care overhaul was passed, the Obama administration knew that the Class Act was a seriously flawed program that could not be implemented. For example, Medicare actuary Rick Foster said way back in June of 2009, quote, 36 years of actuarial experience lead me to believe that this program would collapse in short order and require significant federal subsidies to continue, close quote. Yet these warnings went unheeded, and the Class Act remained in the health care bill 9 months later because it created an illusion of budget savings, an illusion based entirely on the fact that it was designed to collect premiums for a full 5 years before it would have to start paying benefits. Yesterday, the Congressional Budget Office estimated that the cost of federal health care entitlement programs will more than double over the next decade. Madam Chairman, for the sake of our nation's future, we must get these costs under control. The Class Act is an unsustainable program that, if it ever begins operating, would inevitably need a major taxpayer bailout. By repealing it today, Congress can send a clear message that we are going to start finding solutions to rising health care costs instead of making the problem worse. I yield back.
Gentleman yields back. The gentleman from California.
Reserve the balance of my time.
Gentleman reserves. Gentleman from Louisiana.
Madam Chair, how much time do we have remaining?
Gentleman from Louisiana has 3.5 minutes remaining. The gentleman from California has 5.5 minutes remaining.
I'm pleased to yield, Madam Chair, 1.5 minutes to the gentlelady from Kansas, Ms. Jenkins, a member of the House Ways and Means Committee.
Gentlewoman from Kansas is recognized for 1.5 minutes.
I thank the gentleman for yielding. There aren't many areas where the former Kansas governor and current Secretary of Health and Human Services, Kathleen Sebelius, and I agree on. But one thing we do agree on is that the Class Act portion of the President's health care package is completely unviable and needs to be stopped. That's why I was glad to hear the Secretary backtrack on her prior support and pull the plug on the program, and it's why I support a statutory repeal of the Class Act today. This act was designed as a new national entitlement for purchasing community living assistance services, and it was used by this administration as a pay-for to substantiate their faulty claim that Obamacare was going to reduce the deficit. However, as I and many others pointed out at the time, the deficit reduction claim was bogus and based on budget gimmicks that proved false when HHS began implementation. You see, the CBO can only project the cost of bills in a 10-year budget window, so the Obama administration used a budget trick by setting up the Class Act to begin collecting premiums in 2012, but not paying out benefits until 2017. Great for years 1 through 10, but very bad for years 5 through 15 or later. This gimmick led CBO to report that the program would reduce the deficit, but it certainly doesn't take a CPA to realize that these initial savings can't be sustained over time. While we anxiously await the Supreme Court's decision on the constitutionality of Obamacare as an individual mandate, I urge my colleagues to support the repeal of this failed portion of the bill today so we can get this budget gimmick off the government's books.
The woman's time has expired. The gentleman from California?
Reserve the balance.
The gentleman reserves. Gentleman from Louisiana.
Madam Chair, I'm now pleased to yield 1 minute to Ms. Black, a member of the House Ways and Means.
Gentlewoman from Tennessee is recognized for 1 minute.
I thank the gentleman for yielding. And, Madam Speaker, I rise today in support of my colleague from Louisiana's legislation repealing this unsustainable budget gimmick that created to make the health care law look less expensive. The Class Act was a long-term entitlement that was plagued with problems from the very beginning. And from day one, concerns raised about the Class Act's program unsustainable cost structure, the administration ignored it. I have a chart that was presented to us in our Ways and Means on the markup of this bill, and from the very beginning there were 6 different occasions and up until March the 20th when it was passed of experts who said this was unsustainable, and they've already been referenced in the past speakers. Since that time of passage, there were 4 others, including then Secretary Sebelius in October of 2011, who also said, I do not see a viable path forward for the class implementation. This program, again, has been unsustainable from the very beginning, and I think what is so sad is that we continue to put our head in the sand and make the American people believe that this program is somehow workable. This needs to be removed from our law so that we can start again. This is a nonpartisan issue, and we all need to work together in a bipartisan way. As a nurse for over 40 years, working with elderly, I recognize the need for long-term care.
Gentleman's time has expired.
Thank you, Madam Speaker.
Gentleman's time has expired. Gentleman from California.
Madam Chair, I'd like to reserve the balance of my time, but pending that, I'd like to ask unanimous consent to introduce into the record a letter of support.
Request will be considered under general leave, and the gentleman from Louisiana has the right to close. The gentleman from Louisiana has 1 minute remaining. Gentleman from California has 5½ minutes remaining.
We're ready to close.
Fine. Madam Chair, in closing, I'll repeat that there are real problems in this country of much more urgency than trying to repeal a bill that doesn't do anything, that won't work, that the President said won't be effective. I urge my colleagues to join me in voting no on this Republican agenda to tear down our health system. It's mugwumpish. It just sticks your head in the sand and says, let's repeal things and let's not go about fixing it. As I said before, I'm sure that Dr. Bustani has a great bill. I'm hoping that he'll bring it to us and we could proceed to deal with the problem of long-term care for our senior citizens. I have 7 children who'd like to see that done very quickly and get me off their hands. Thank you very much. And so anything we could do together, I'll look forward to working with distinguished gentlemen. And with that, I yield back the balance of my time.
Gentleman yields back. Gentleman from Louisiana.
Madam Chair, I'm pleased to yield the remaining time to Mr. Paulson, a distinguished member of the House Ways and Means Committee.
Gentleman from Minnesota is recognized for 1 minute.
Thank the gentleman for yielding. Madam Speaker, I also want to rise in strong support of repealing this misguided Class Act. We knew from the start that the Class Act was fiscally unsustainable, but the President and those who supported the new health care law used this and inserted it as a budget gimmick to help pass the law. This new program was an illusion that was crafted so the government would start collecting funds long before it would pay anything out, making it seem as if it would raise revenue and save money. But in the long run, it was obvious and it was clear that the program would have disastrous effects. The CMS chief actuary himself said that if implemented, the program would collapse. And after months of failed attempts, even the administration now has finally admitted that the program was unworkable. Madam Speaker, Minnesota families and small businesses are tired of the smoke and mirrors coming out of Washington. Let's do the right thing today and repeal this terrible program. Let's focus on what's really important, putting Americans back to work. I want to thank my colleague on the Ways and Means Committee from Louisiana. He's a doctor, he's a physician, he's a leader in health care. Let's do the right thing and repeal this legislation. Thank you, Madam Speaker.
Gentleman's time has expired. All time for general debate has expired. Pursuant to the rule, the bill shall be considered for amendment under the 5-minute rule for a period not to exceed 3 hours. The amendment in the nature of a substitute recommended by the Committee on Energy and Commerce printed in the bill shall be considered as an original bill for the purpose of amendment under the 5-minute rule and shall be considered read. No amendment to the committee amendment in the nature of a substitute shall be in order except those received for printing in the Congressional Record designated for that purpose in a daily issue dated January 31, 2012, or earlier, and accept pro forma amendments for the purpose of debate. Each amendment so received may be offered only by the member who caused it to be printed or a designee and shall be considered read if printed. Are there any amendments? Would the gentlewoman please classify which amendment? Clerk will designate the amendment.
Amendment number 2, printed in the Congressional Record, offered by Ms. Jackson Lee of Texas.
The gentlewoman from Texas and a gentlewoman from Texas is recognized. Gentlewoman is recognized for 5 minutes.
Madam Speaker, let me first of all thank you for your courtesies. We were meeting in the back, and so allow me just a moment. I'm on amendment number 2. Okay. Madam Speaker, first of all, let me say that I was on the floor yesterday regarding the Class Act and my approach to the Class Act. And I recognize that we have had some difficulty with putting together the right balance, the right financial structure for a very large program. But it does not mean that it does not have purpose. The CLASS program deals with long-term care. In my readings, I've determined that private families and loved ones have given, in essence, $450 billion in private care, meaning that they have taken care of their loved ones on their own. $101 billion has been spent by the Medicaid program. And I said yesterday that I've had the experience of taking care of a dear mother who I lost in 2010, right now an aunt who I am taking care of in 2012, and have seen a number of friends and others who need long-term care. And so the idea of disposing of it, to me, seems incomplete. Without projecting back to Health and Human Services, how can we get this done? My amendment would not repeal the class program, the Class Act, until the completion of a macroeconomic study. We must determine the cost of not having long-term care insurance on the federal, state, and local governments before we repeal any programs, like class, that are self-sustaining. Class is not taxpayer funded. The lack of affordable care is a very serious problem which, if not addressed, will only add to our growing national debt. H.R. 1733 would repeal the Class Act and in its totality. And I believe that that is the wrong direction to go. And so I'd be offering my amendment to help 26 million Americans who need long-term care services in the near future. A Class Act is a positive intent, and it deals with the fact that we all must have balance of burden and benefit. We have to recognize that there are those who we have to help. My amendment would ask for that study to be engaged and to ask for the Secretary to come back with an analysis of how devastating the impact would be, how high the deficit would grow. As the former Executive Director for the National Governors Association noted, failure to reform the underfunded, uncoordinated patchwork of long-term care supports and services is a failure to truly reforming health care. Long-term care is not just for the elderly. It's for those who've had catastrophic illnesses, maybe the injured football player or the injured skier or in a major accident when our loved ones need our attention. And oh, how much can be done with long-term care. How do I know it? My mother went into a nursing home and could not walk, but she walked out. Yes, there is value to helping people restore their lives. And baby boomers are already turning 65. 10,000 people will turn 65 every day as of January 1st, 2011, over the next 25 years. And I'm grateful that because of health care and the Affordable Care Act, they will be living longer. Therefore, I'm asking that we not throw the baby out with the bathwater. Allow the Secretary to do this study, and to do this study that will be helpful to all of us. By 2050, the number of individuals using long-term care will excel. I'd like to reserve the balance of my time.
The gentlewoman may not reserve the balance of her time.
Let me just say, Madam Speaker, to my disappointment, I wanted to reserve to engage with my friend, but let me just say this. That care involves home, residential care, skilled nursing facilities, and it will likely double from the 10 million services in 2000 to, as I said earlier, 26 million people. So it makes sense to accept my amendment that would allow this macroeconomic study to look closely at the benefit and the burden of not having long-term care. I can assure you that we will be better informed to be able to have those instructions, and I would ask my colleagues to support this amendment. With that, Madam Speaker, I yield back my time.
The gentlewoman's time has expired. For what purpose does the gentleman from Pennsylvania rise?
Madam Speaker, I rise in opposition to the amendment.
The gentleman is recognized for 5 minutes.
Madam Speaker, again, this amendment continues to ignore the reality around the class program. The class program has been reviewed by outside analysts, by the HHS actuary, the Congressional Budget Office, and just last year, the Obama administration finally admitted what so many already knew. The class program is not workable. In fact, the Congressional Budget Office has certified that not a single person would ever receive benefits from the class program. Any effort to preserve a failed program on the books simply delays any real attempt to ensure every American has access to affordable long-term care coverage. From the start, the class program was a big government idea that independent analysts believed was flawed and unworkable. The American Academy of Actuaries, the Congressional Budget Office, and even officials at the Department of Health and Human Services, run by Secretary Sebelius, had grave concerns about the workability of this program. It has been studied. It does not work. If you would have done this study before you passed it, we would not have wasted millions of taxpayer dollars on a program that was doomed from the start. Perhaps we should visit what the failed implementation of the class program has done, rather than spend millions on a study on what its removal would do. I begin by reminding my colleagues that the class program has done nothing to help reduce federal or state spending. In fact, the Department spent at least $5 million to implement a failed program and an $80 billion hole in the federal budget. I would also remind my colleague that the class program has done nothing for consumers who are left with a failed program that was overpromised to the public as part of the President's monstrous health care law. We must move to take the class program off the books so that we can move forward with solutions that work with the private market, that are affordable for consumers, and don't place additional strain on the federal and state budgets. With that, I yield back.
Further members seeking recognition? This is the gentleman from New Jersey.
Madam Speaker, to strike the last word.
The gentleman is recognized for 5 minutes.
I yield the time to the gentlewoman from Texas.
I thank the gentleman for sure. Madam Speaker, first of all, I want to make it very clear that my amendment is amendment number 2 to H.R. 1133. I might have misspoken earlier, and I have another amendment, which is amendment number 1. But I do want to respond to the gentleman and just indicate that best practices have not been assessed. The point of my amendment is to get us focusing in what the numbers need to be to increase the viability of life and care for those needing long-term care, juxtaposed against the enormous debt and deficit that will occur if no one has long-term care, or we continue to have to utilize Medicaid, which is at $101 billion, private insurance is only at $14.5 billion, and then the burden on family members, aging family members, their care, they have put in their pound of support at $450 billion. We can at least pay attention to new numbers by asking for best practices to be assessed. And I believe if we do that, we will have the opportunity to do the right thing by the American people, and we will be, in essence, being productive. No one can deny the fact that having insurance that has eliminated people being eliminated from insurance for a pre-existing condition is not good. No one can say that having children on your insurance to 26 is not good. No one can say that not being kicked out of a hospital bed because you have flatlined on your insurance is not good. It is good. And we recognize that coming together in a bipartisan manner, we can in fact make this right. And we can find a way to help those families right now, Alzheimer's, where families are taking care of that loved one, they need support, and they need it in a structure that can help provide them with resources for long-term care. I ask my colleagues to support a thoughtful amendment that deals with providing additional information, and I'm happy to yield back to the gentleman and thank him for his time. I ask my colleagues to support the Jackson Lee number 2 amendment on a macroeconomic study on the benefits and burdens of repealing the Class Act.
I thank the gentlewoman, and I yield back my time.
Questions on the amendment offered by the gentlewoman from Texas? Those in favor say aye. Those opposed, no. In the opinion of the chair, the noes have it.
Madam,
the amendment,
ask for the yeas and nays.
Does the gentlewoman ask for a recorded vote?
Yes, Madam Speaker, I ask for a recorded vote.
Pursuant to Clause 6 of
Madam
Rule
Chair.
18, further proceedings on the amendment offered by the gentlewoman from Texas will be postponed. Recognition.
Madam,
For what purpose does the gentlewoman from Texas rise?
I have an amendment number 1, I believe.
Clerk will designate the amendment.
Amendment number 1, printed in the Congressional Record, offered by Ms. Jackson Lee of Texas.
Gentlewoman from Texas is recognized for 5 minutes.
I thank you so very much, Madam Chair. And again, I rise with great concern about H.R. 1173. And again, I want to make it very clear that in all the course of traveling throughout my district, when the Affordable Care Act was passed in 2010, there was a great deal of emotion and celebration. I take, for example, those senior citizens who were continuously falling through the hole on Medicare Part D. This particular legislation helped close a donut hole where seniors' prescription drugs did not skyrocket, and therefore they could not make a decision between their prescription or between their rent or what they ate. This resolution is very clear. It simply states Congress resolves that health care is necessary for a healthy population, humane treatment of impoverished citizens, and to help reduce the budget deficit, and that long-term care insurance represents 1/3 of federal and state spending on Medicaid. It's a simple statement of fact, Madam Chairwoman, and I would ask that this simple statement of fact be added to this legislation. I think it will be a positive statement. It will give us the connectedness to say that we have got to get back to the drawing boards and make sure that we have, in fact, the right kind of insurance for people in need. I can't imagine why we want to abandon those who need long-term care. As I've indicated, it may be a young person who faces a catastrophic illness or accident. It may be a child suffering from a chronic disease. It may be some of our friends who suffer from issues dealing with mental health. In my own community, just recently, one of our major hospitals with mental health beds was closed down, 148 beds. Who knows what will happen to those patients, some of whom actually stay in that facility for a period of time. We know we don't have enough mental health beds and beds for those who need long-term care suffering from conditions dealing with their mental health. My amendment is recognition of the fact that the issue of long-term care services is not going away. The enormous costs of not providing the rainy day umbrella, the cushion for families and those who are suffering from devastating disease just cannot happen. It cannot be swept under the rug. The cost curve is steep and growing, and we cannot continue to kick the can down the road. Long-term care, again, is fundamental. And so this particular legislation acknowledges that. 40% of long-term care users today are between ages of 18 and 64, as I said. While most people who need long-term care are in their 70s and 80s, as I said, many younger people are facing the horror of disability or a disability without any way of paying for it, without giving relief to their family members. Long-term care is expensive and can quickly wipe out hard-working family savings, which gives many families a Hobson's choice: spend down and wipe out years of hard-working services to qualify for Medicaid. For those of you who don't know how Medicaid works, because we want to be responsible with federal tax dollars, you have to be down to zero. Your house has to be sold. Your car has to be sold. Any assets have to be sold, and everything you have goes back into the system. Well, I know there are people who believe that they want to pay part of this burden, but there are others who understand that in addition to paying, why should they be made completely indigent? Why can't that person remain in their home even with care, which is another part of long-term care? It gives the opportunity for families to be together and for that individual who's injured to be able to be taken care of inside their home, the loving family, but yet having the long-term care providers. This is a simple statement. I hope my colleagues will not oppose the idea that long-term care is important and that we have to respond to it by way of ensuring that we don't grow the deficit. The average lifetime long-term care spending for a 65-year-old is $47,000. 16% will spend $100,000 and 5% will spend $250,000. There's no doubt that we need relief. Nationwide, the median annual cost of a nursing home in 2010 was $75,000 room and board in an assisted living facility. This is a crisis that will impact the debt, and therefore I would argue that repealing the Class Act without a positive statement, Madam Chair, of how important it is tragic. I ask my colleagues to support the Jackson-Lee Amendment, stand up and be counted for the value of long-term care support here in America. I yield back, Madam Chair.
Gentlewoman's time has expired. For what purpose does the gentleman from Pennsylvania rise?
Madam Chair, I rise in opposition to the amendment.
Gentleman's recognized for 5 minutes.
Madam Chair, this amendment continues to ignore the reality. The class program is simply not workable. Keeping the class program and pretending that it will ever work does absolutely nothing and offers no help to millions of Americans who want to maintain their health. Any effort to preserve a failed program on the books simply delays any real attempt to ensure every American has access to affordable long-term care coverage. From the start, the class program was a big government idea that independent analysts believed was flawed and unworkable. In fact, the Obama administration officials pointed out serious concerns with the class program as early as the beginning of 2009. While those concerns went ignored by the administration until earlier this fall, now is not the time to stall its repeal. Yesterday, Senator Harkin told reporters that the only way to make class work is to make it mandatory. Are the supporters of the Class Act really advocating another mandate? Keeping class on the books is a step in that direction. Keeping the class program on the books also further threatens the private market and the nearly 8 million Americans who have private long-term care insurance today. You cannot have a functioning long-term care insurance market if there is a continued threat of a government takeover of that market. We need long-term care reform that builds on what the private market provides, not destroy it. I hope that those on the other side of the aisle have the courage to admit their mistake, repeal this law, and begin to work on a real workable long-term care policy. I urge members to oppose this amendment, and I yield back.
Gentleman yields back. Does anybody, any other member time? Gentlewoman from Tennessee.
Word.
Gentlewoman's recognized for 5 minutes.
Thank you, Madam Speaker. I oppose the amendment, and I stand here today in support of repealing the Class Act. You know, it's been almost 2 years that we saw passage of the Obamacare bill in this chamber, and it is something that we have worked since taking the majority to repeal this and get it off the books. And indeed, what we are seeing is a need to get this Class Act off the books. Despite the federal government's best efforts, there is no way to show that this is going to save money. Indeed, in a budget gimmick, as we were discussing this bill in committee a couple of years ago, what they did was to come in and say, oh, this will save $80 billion. Oh, let's add Title VIII to the bill. Let's add Sections 8001 and 8002 to this legislation, and let's create this little pool here where we're going to have near-term expenses that are supposed to yield us some long-term savings. The problem is all the new math you wanted to put to work on this, Madam Speaker, there was no way to show that it was ever going to save money. And indeed,
Secretary Sebelius, who is the Health and Human Services Secretary, was forced to admit last October that there was no path forward for this program. So what we need to do is to say this was a mistake. It doesn't save money. It is not going to address a problem. It is something that needs to come off the books. It is a way we can step forward and we can take a program off the books. And I encourage my colleagues to support ending the Class Act, getting it off the books. And I yield back the balance of my time.
It's back. Does anyone seek time? The question then is on the amendment offered by the gentlewoman from Texas. Those in favor say aye. Those opposed, no. No. Opinion of the chair, the noes have it. The amendment is gentlewoman from Texas.
I ask for a recorded vote.
Pursuant to Clause 6 of Rule 18, further proceedings on the amendment offered by the gentlewoman from Texas will be postponed. For what purpose does the gentleman from Florida rise?
Madam Chair, I have an amendment at the desk.
Would the gentleman please specify which amendment?
Amendment number 4, Madam Chair.
Amendment number 4. The clerk will designate the amendment.
Amendment number 4, printed in the Congressional Record, offered by Mr. Deutsch of Florida.
Gentleman's recognized for 5 minutes.
Thank you, Madam Chair. Although I regret that this Congress is considering the full repeal of a promising effort to address the looming long-term care crisis in our country, I have to admit I'm not surprised. This is the action of a Congress deserving of America's low opinion of us. We know the facts. A vote against this amendment is a vote for increased Medicaid spending. No one is immune from becoming disabled or growing old, yet just 10% of Americans over age 50 can afford long-term care insurance. As a result, a staggering 90% of Americans rely on long-term care provided by Medicaid. It is no wonder that over a third of Medicaid spending is on long-term care, not on checkups for impoverished children, not on prenatal care for poor expectant mothers. No, it is the expensive, institutionalized long-term care funded by Medicaid. The goals of the CLASS program represented an alternative to this system on which we all could have agreed, a fully solvent, affordable, premium-financed long-term care program. It emphasizes personal responsibility, lessens the burden on taxpayers, and reduces unnecessary Medicaid spending. And sometimes, as things happen here, Congress passes imperfect legislation. But rather than address these imperfections, the legislation before this House today gives up on our grappling with this long-term care crisis altogether. We've overcome challenges like this before. In the early 1980s, Social Security faced a crisis. So what happened? Did my Republican friends, concerned about having an imperfect law on the books, castigate what they called Roosevelt care and bring to the floor a 2-page bill to revoke the Social Security Act? It's not, thankfully, what happened. What did happen was that Democrats and Republicans worked together with President Reagan and strengthened Social Security. As a result, Social Security continues to keep millions out of poverty, ensuring against the universal risks of old age, disability, or death of a breadwinner. The amendment I offer today would prevent repeal of the CLASS Act from taking place if failure to implement the CLASS program would increase state and federal Medicaid spending. Greater reliance on the safety net has led many to conclude that Medicaid has become unaffordable. Instead of cutting basic health care for our most vulnerable, the elderly, the disabled, poor children, we ought to reduce Medicaid spending. We ought to put more Americans back to work. We ought to make private health insurance more affordable. There are many prescriptions for reducing Medicaid spending, but let's be clear. Repeal of the CLASS Act and upholding our long-term care crisis is not among them. The Congressional Budget Office estimates that even if the imperfect CLASS bill that passed would reduce Medicaid spending by at least $2 billion, if more older Americans had access to affordable long-term care insurance, middle-class seniors could secure a less costly, more independent lifestyle in their own homes instead of spending down into poverty to receive expensive institutionalized care. What message is Congress sending by repealing CLASS? we are proclaiming that the current system, which incentivizes elder poverty and forces seniors to blow through their life savings, is just fine. Save nothing. Pass what you do have on to your children before you get sick. Own little property and don't purchase long-term care insurance. Follow this plan and you'll be eligible for expensive institutionalized care through Medicaid. If class is repealed, it is exactly the children and grandchildren that my friends on the other side say they worry about who will pay the cost. A premium finance long-term care program would shift people from reliance on Medicaid. This should be our shared goal. We ought to work together to fix a program that represents the first real path toward making affordable long-term care available to middle-class families who want to secure themselves against possible poverty. I respectfully ask my colleagues to support this amendment because reducing Medicaid spending while improving the lives of seniors and persons with disabilities is a conversation worthy of this office. And with that, I yield back.